Hello and welcome for a webinar on anatomy of nose. And the most important part of anatomy of nose is, of course, the lateral wall of nose. In examination, most of the time, lateral of the nose is asked. Sometimes nasal septum is also asked. So let us have some basic knowledge about this nasal cavity. You know, we have got two nostrils, okay? So the nose is subdivided into right and left halls by a nasal septum. That is why we have two nostrils. The two halls open anteriorly on the face through the nostrils. So nostrils means the anterior nares, and posteriorly these nasal cavities open into the nasopharynx through the posterior nasal aperture. So through nostrils anteriorly and through posterior nasal apertures posteriorly. You can see in this picture the anterior opening, nasal opening, okay, and the posterior nasal opening. Rest of the parts we will understand in the next slide. Nose is not all, cartilaginous. It is also bony. The most of the part, which is mostly hidden in the face, is made up of bones. So let us understand the bony skeleton of the nose. For example, roof, floor, medial wall of the nose. Okay. So in this study, we are also going to study the medial wall of the nose, which is made up of nasal septum, and lateral wall we will study later on. So first we'll try to understand how the roof of the nose is made up of. You can look at this picture. Anterior part of the roof is formed by the nasal part of the frontal bone. Here you can see the frontal bone. Okay. Middle part is formed by the cribriform plate of the ethmoid bone. Okay. Cribriform plate of the ethmoid bone is here. And the posterior part is formed by the body of sphenoid bone. So we are talking about the bony part here. Okay. So these are the three bones: nasal bone, frontal bone plus nasal bone, then cribriform plate of ethmoid bone, and posterior part is made up of body of sphenoid bone. Now that we come to floor, here there is a floor, okay? Here. Anteriorly, the floor is formed by the palatine process of the maxilla. We have studied this at the time of hard palate. So this was hard palate structure. Now it has become floor of the nose. It was roof of the mouth. Now it is floor of the nose. And posteriorly, horizontal plates of the palatine bone here. So this is about your floor of the nose. We are into the nose, okay? One by one we study. And now medial wall. Medial wall in between the two nasal cavities, there is a septum, and that is called as a nasal septum, and that I told you. So medial wall is made up of nasal septum, but nasal septum is formed by three, components. One, posterior inferiorly there is a omer bone. You can see omer bone here. So this is the posterior inferior part of nasal septum. Superiorly there is perpendicular plate of ethmoid. This is perpendicular plate of ethmoid. And antero-inferiorly there is a septal cartilage. So this gray, bluish gray is a septal cartilage. So what we hold in our, a pinch of your hand, you always hold in a pinch of your hand, that is the cartilage. It's a septal cartilage, and it is fibrocartilage. Okay. So this is about medial wall. Now what important thing remains in the nose is the lateral wall of the nose, which is little complicated. So it is a complex part of the nose, and that is commonly asked in exam. So medial wall means nasal septum, and roof and floor you have understood. Now we'll go to the lateral wall of the nose, and but prior to that we have to study the nasal septum once again. Now the lateral wall of the nose consist of nasal conchae and myiasis. So there are nasal conchae and nasal myiasis. Now the lateral wall of the nose means one nose will have two lateral walls and one septum in between the two the nasal, what you call nostrils also, and nasal cavities, there is in between a septum. Three conchae and meatus. Conchae means bony projections or bony plates which are covered with the mucous membrane. Conchae, okay, one is concha, and there are three of them. So 1, 2, 3 means superior nasal concha, middle nasal concha, and inferior nasal concha. Remember, they are not cartilages, they are bony projections or bony plates or self-like. कपाटाला कसे असे खाणे असतात तसे त्याला नाकाच्या साईडला असे खाणे असतात, त्या खाण्यांना आपण म्हणतो कॉन्की. ओके. अँड मियाटसिस मीन्स डिप्रेशन्स किंवा पोकळी, पोकळी आपण म्हणू. सो दे आर द डिप्रेशन्स बिलो अँड lateral to each conchae. So below each conchae there is a space or a depression, shallow space, hollow space, and those are called as meatuses. And there are three of them: superior nasal meatus, middle nasal meatus, and inferior nasal meatus. If you write only this is a good introduction to the lateral wall of the nose. Okay. Now one by one we will try to understand these different meatuses, what are they meant for. Superior meatus, okay, it receives the opening of the posterior ethmoidal air sinus. Posterior ethmoidal air sinus, here you can see the superior meatus, here you can see the middle meatus. Middle meatus is quite big. Superior meatus is a small space, and inferior relatively bigger than the superior, but the bigger one is the middle meatus. So in the superior meatus, that means just below the superior nasal concha, there is opening of posterior ethmoidal sinus. So for this purpose, we have to understand the names of various paranasal air sinuses. Altogether, there are, we call collectively as a 4 pairs of paranasal air sinuses: frontal, ethmoidal, sphenoidal, and maxillary. These are the 4 pairs. Four on this side and 4 on that side. But the ethmoidal sinus is having 3 divisions: anterior, middle, and posterior. Okay, ethmoidal having 3 divisions. That is why one of that division is posterior ethmoidal sinus that opens in the superior meatus. Okay, so here you can see the opening only one part of ethmoidal sinus. Other 2 we will see in the next slide. Now we have come to the middle meatus. So here you can see the big space here, middle meatus. This middle meatus has got 2 important structures called as bulla ethmoidalis and hiatus semilunaris. Bulla म्हणजे उंचवटा आणि hiatus म्हणजे खड्डा, depression. Semilunaris means it's like a semi-lunar half moon. So bulla ethmoidalis means it is a rounded elevation where the middle ethmoidal air sinus open in it. Now we saw posterior ethmoidal sinus opening in the superior meatus, and middle ethmoidal air sinus is opening in the on the height or on the summit of bulla ethmoidalis. Here you can see the bulla, and here you can see the opening, and just anterior lateral to it is a hiatus semilunaris. Hiatus semilunaris it is quite long. So this is a crescentric groove lying below the bulla ethmoidalis. It receives 3 openings. Altogether, 3 openings are present in the hiatus semilunaris. One is anterior ethmoidal sinus. So the ethmoidal sinus, which was remaining is anterior ethmoidal sinus. Next is frontal air sinus, and third is maxillary air sinus. So all the 4 pairs of sinuses get over here itself. All 4 means, I mean to say, frontal, ethmoidal, sphenoidal, and maxillary. So sphenoidal sinus is yet to be seen. We'll see that later on. But out of 3 ethmoidal sinus, we have seen all 3. Frontal is 1 opening, and maxillary is only 1 opening. So frontal air sinus here. So altogether there are 4 openings in the middle meatus. Okay, 4 openings means 2 ethmoidal, 1 frontal, and 1 maxillary. Still sphenoidal air sinus is remaining. We'll come to that later on. Now we will come to inferior nasal meatus. Here this is the inferior nasal meatus, just below the inferior nasal concha. Now let me explain to you, this inferior nasal concha is a bony projection, not of any other bone, but it is an independent bone. जे 22 बोन्स आहेत आपल्या स्कल मध्ये, त्या 22 पैकी तो एक आहे, स्वतंत्र आहे तो. सो inferior nasal concha is a independent bone, whereas superior nasal concha and middle nasal concha आर दी बोनी प्रोजेक्शन्स ऑफ एथमॉइडल बोन. म्हणजे एथमॉइड नावाचा जो बोन आहे स्कल मधला, त्याचे ते भाग आहेत पहिले दोन, आणि हा शेवटचा हा स्वतंत्र बोन आहे, तो कोणाचा भाग नाहीये. ओके, सो जस्ट मेक इट क्लिअर अबाउट द ओरिजिन ऑफ दिस कॉन्की. Now this inferior nasal concha has got a space below it, and that becomes your inferior nasal meatus. It receives nasolacrimal duct here. That means nasolacrimal duct means from it is there is a canal or a duct connecting eye to nose. म्हणजे डोळ्यांच्या मध्ये जे टिअर साठतं ते त्याचा निचरा केला जातो नाकामध्ये नकळत. So that is a duct draining the tears from the eyes and bringing down into the nose. From nose it can fall outside, so you can wipe it off like this. Okay, like this. So that is the provision for nasolacrimal duct to drain the excess tear formed in the eyes to nose. So now we have finished all the three meatuses and all the three conchae. But what about the opening of sphenoidal air sinus? एक air sinus राहिला तो ओपन झाला पाहिजे नाकामध्ये. So you have to go on the top of the lateral wall of nose here, above the superior meatus, just above the superior meatus. This region is called as sphenoethmoidal recess. Recess म्हणजे एक छोटी space, जशी सुट्टी असते तशी छोटी सुट्टी, interval. So there is a small space here. So it is a triangular fossa between the superior nasal concha and the roof of the nose here. It receives the opening of the sphenoidal air sinus. Sphenoidal air sinus. So if you count all the 4 paranasal air sinuses, amongst those 4, ethmoidal has got 3 components. So actually they become 2 extra होतात, त्यामुळे ते 6 opening होतात. So I'll count from above downwards now. In the sphenoethmoidal recess, there is opening of sphenoidal air sinus. In the middle meatus, there is opening of posterior air sinus. In the superior meatus, there is opening of posterior ethmoidal air sinus. हे सगळं म्हणता आलं पाहिजे नीट. So now we have come to the middle meatus. In the middle meatus, on the bulla ethmoidalis, there is opening of middle ethmoidal air sinus. Now in the hiatus similaris, there is opening of anterior ethmoidal air sinus, frontal air sinus, and maxillary air sinus. Okay, so 1, 2, 3, 4, 5, 6. Okay, 6 झाले. So all 6 air sinuses are over because ethmoidal is 3, so we count it as 6. Otherwise you have to say there are 4 pairs of ethmoidal air sinuses. I am again and again explaining this to you. Then what is this inferior nasal meatus is for? It is for the opening of nasolacrimal duct. So this previous slide, this one, and this slide, only these 2 slides if you consider and take it for your study, and you can elaborate on it to make a big फुल क्वेश्चन 10 मार्क्सचा क्वेश्चन असू शकतो लॅटरल ऑफ नोज वरती, आणि हा डायग्राम महत्वाचा आहे. इफ यू ओनली डू दिस, यू विल गेट आउट मार्क्स. ओके, नाउ विल गो टू द arterial supply of the nose. So arterial supply of the nose is very important because of this one point here. You can see one point highlighted here, because nasal bleeding is very common. We call it as epistaxis. For that purpose, we have to understand the arterial supply, blood supply of the nose. The first one is spinopalatine artery. It is a branch of maxillary artery. So maxillary artery, because we are in the maxillary area, so everything is all maxillary. So maxillary artery is a branch of external carotid artery, that you know. Another branch is septal branch of superior labile artery. Superior labile means lip. Superior means upper lip, and it is a branch of facial artery. The facial artery ची branch superior labile artery, and superior labile artery ची branch septal artery. Septal artery because it is going to the nasal septum. Another is ascending branch of the greater palatine artery. Now, greater palatine artery, it comes from the maxillary artery. These three arteries, if you understand, then we go for one important anastomosis here. There is anastomosis between the above three arteries, 1, 2, 3, that is spinopalatine artery, septal branch of superior level artery, and ascending branch of the greater palatine artery. They anastomose between the above three arteries to form Kisselbach's plexus. This name is Kisselbach. Spelling part karun gya. On the antero-inferior part of the nasal septum, and this is called as Little's area. Little is a name of anatomist. Kisselbach is also name of anatomist. Okay, Little's means small name. So Little is a name given. Now, if you take this nasal septum into consideration and त्याचे जर आपण चार भाग केले असे आणि असे केले तर हा जो पुढचा आणि खालचा शेवटचा क्वाड्रंट राहतो हातामध्ये शिल्लक त्याला आपण म्हणतो anterior inferior quadrant of nasal septum. So it comes very anterior side, एकदम पुढे येते त्यामुळे नाकातून टप टप रक्त गळू शकते ते दिसतं आपल्याला. So this little area is clinically very important because this area is common site for epistaxis. Epistaxis means bleeding from the nose. That is why the arterial supply of the bone is quite important. Even the smallest of the injury can cause easy bleeding from this point because there is a heavy blood supply due to the anastomosis. So if you write about Kisselbach's plexus and Little's area, epistaxis, and if you mention all these three arteries, it becomes a good note on nasal septum. Now, nasal septum is made up of bones also and is made up of cartilage also. We saw those in the previous slide. Ethmoidal bone, omer bone, and the nasal septum make a nasal cartilage, make a nasal septum. Now, we are in the cartilaginous area where this little area is located. Anterior and posterior ethmoidal branches of the ophthalmic artery supply the roof and upper parts of the lateral wall of the nose and the septum. This is another ophthalmic artery gives one branch called as posterior ethmoidal artery, and we supply the roof and remaining part of the nose. Okay. Now, nose has got an important ganglia located there. Like we saw one submandibular ganglia while studying submandibular region. Here we can have one ganglia important spinopalatine ganglion. Sometime note may come on this also. It is a parasympathetic type of ganglion and is located in the pterygopalatine fossa. Okay. If you get time, you can read on this ganglion more. Now, how it is formed? If you see the roots, preganglion fibers coming from maxillary nerve are sensory, and sympathetic supplies from deep petrosal nerve, which arises from the sympathetic plexus around the internal carotid artery, and parasympathetic from greater petrosal nerve, which is branch of facial nerve. Here you can see the spinopalatine ganglia. Pterygopalatine fossa is seen here, and spinopalatine ganglion in the pterygopalatine fossa is seen here. So this is the pterygopalatine fossa with spinopalatine ganglion. And here, for better understanding, you can take the reference of the skull to understand the bony relations of this. The spinopalatine ganglion gives different branches like postganglionic secretomotor fibers which supply the lacrimal gland. Lacrimal gland, which is located on the lateral side of the orbit, okay, just above the eyeball, which secretes the tear. Lesser palatine nerve is another branch. Greater palatine nerve is another branch. Now, greater palatine nerve gives the lateral posterior inferior nasal nerves. Lateral and medial posterior superior nasal nerves are branches of spinopalatine ganglion. So, nasopalatine nerve, long spinopalatine is the other name of that nerve. Pharyngeal branch to the pharynx and branches to the orbital periosteum. So this supplies the surrounding area. So nasopalatine, spinopalatine ganglion supplies the nose area. That is why we have counted this in the study. The postganglionic branches of the spinopalatine ganglia supply the mucous glands of the palate, nose, nasopharynx, and the lacrimal gland. Now, no supply of the nose overall, lateral wall, if you see, One is olfactory area, because nose has got an olfactory area which is 1 centimeter, and it is supplied by the olfactory nerve, which is for the purpose of sensation of smell. This area includes the roof and upper parts of the septum and the lateral wall of the nose, lateral nasal walls also, from where the nasal sensation is carried. Vas. Okay. Another is vestibular area. Vestibular means in front, which is supplied by infraorbital nerve. And respiratory area of the lateral wall of the nose, this is not olfactory, this is respiratory, meant for respiration, is supplied by anterior superior part is supplied by the anterior ethmoidal nerve. Anterior inferior part is supplied by internal nasal nerve. Posterior superior part is supplied by the lateral posterior superior nasal branch, and posterior inferior part is supplied by lateral posterior inferior nasal branches from greater palatine nerve. So this is all about your nerve supply of the nose. Don't forget this spatial sensory nerve, that is olfactory nerve. Well, now we have already talked about paranasal air sinuses. They are air-filled spaces in certain bones. We call them as pneumatic bones, which form the boundary of the nasal cavity. These paranasal air sinuses are also called as sound box collectively. They open into the lateral wall of the nose. We have seen all those 6 openings now. Their function is warming and humidifying the inspired air. The air which we inhale, that is made warm and humidified in order to send it into the oropharynx and then further into the lungs. And they diminish the weight of the skull also. Because of presence of air in the bones around the nose, we feel our head quite light, and they add resonance to the voice. We are able to hear from each other because of those sinuses, and they add resonance to the voice. That is why they are called as sound box. And they all of them open in the nasal cavity in various openings through all those 6 openings which we saw on the lateral wall of the nose. And they are maxillary sinus, frontal sinus, sphenoid sinus, ethmoid sinus. It is present, maxillary sinus is present inside the maxillary bone or maxilla. Frontal sinus is present between the 2 plates of the frontal bone, frontal sinus. Sphenoid sinus present in the body of the sphenoid bone, and ethmoid sinus inside the lateral part of the ethmoid bone. And there are 3 components. Ethmoid is in 3 components: anterior, middle, and posterior. That is why we get 6 openings. And here you can see all those paranasal air sinuses which are opening into the lateral wall of the nose. So in a nose, the lateral wall of nose is a very important question for exam. Another is paranasal air sinuses, and the last is nasal septum. At least these 3 points you should know. यातलं कुठलं ना कुठलं exam मध्ये येतच. All the sinuses are present at birth. So during birth they are present, except the frontal sinus, which appears during the 2nd year. Okay, after the closure of the anterior fontanelle. So this is all about the study of nose. And my dear students, I told you that this is a short study. We have decided to do all study precisely, and which is important for exam that we are considering these days. And if you have any questions on this, you can ask me.
Hello, sir.
Yeah.
Sir, फेरोमोन्स हे काय असतात?
काय म्हणतात?
फेरोमोन्स हे काय असतात? फेरोमोन्स
स्पेलिंग ला स्पेलिंग
PH
you can write the spelling in the chat box so that I can stop the video here. And let us stop the video here first so that I can answer your questions. Okay. Thank you. Thanks a lot.